The stage is set for the 2020 campaign, and so is the Democratic ticket. Ahead of this week's virtual convention, we're hearing from the Biden-Harris campaign, and we'll get reaction from Indiana Senator Mike Braun, former Senator Joe Donnelly, and Trump campaign spokesman Hogan Gidley. Plus, I'll talk about the coronavirus crisis with Surgeon General and former Indiana Health Commissioner Jerome Adams. It's all ahead this Sunday in Focus.
This is a moment of real consequence for America.
Historic moments on the campaign trail this week as Senator Kamala Harris is added to the Democratic ticket, kicking off a busy couple of weeks with the virtual conventions set to begin tomorrow. It's a very different election year in the midst of this pandemic. The conventions, the big events on the campaign trail, everything has a different look and feel. We're going to talk about the race for president later today, but we're also getting the latest this morning on the coronavirus crisis. And we start with my exclusive interview with Surgeon General and former Indiana Health Commissioner, Dr. Jerome Adams. Dr. Adams, thanks so much for being with us. I want to ask you about the coronavirus here in Indiana. A couple weeks ago, Dr. Birx warned that Indianapolis could be an emerging hotspot. What stands out when you look at the numbers here in Indianapolis and across the state of Indiana?
Well, thank you for that question. And again, Indianapolis has been on our radar screen. What we try to do is divvy up not just states, but also cities into what we call green, yellow, and red. Green is if your positivity rate is less than 5%, yellow is 5 to 10%, and red is over 10%. Indiana as a state now has a 7.8% positivity rate when you look at the last 7 days average. And Marion County and Allen County, where I'm actually right now, are over 10%. So we want the people of the state to know, and particularly those regions to know, we are concerned, but we also want them to know that we have the tools to be able to turn this around very quickly. What I call the 3 W's. Number 1, wash your hands. Number 2, watch your distance, meaning stay 6 feet from others and avoid crowded indoor spaces. And number 3, wear a mask. If we do those 3 things, we can turn a red into a yellow or a yellow into a green, and we can open and do it safely and stay open.
What about the delays in getting test results back? How much of a problem is that causing here in Indiana and across the country?
Well, it's important to know that a test result that comes back 7, 10, 14 days later does not allow us to isolate and contact trace, which is something that we feel is important to contain the virus. So we're very cognizant of concerns about delays. What I will tell you is about 50% of the testing done in the nation is done either point of care, which is 15 minutes or less, or in hospitals, which is 24 hours or less. So what we're really talking about is the 50% of tests that are done in private labs. And right now, I talked to our testing czar this morning. The testing time on average across the country is now down to less than 3 days for the private labs, and most private lab tests are coming back within 2 days. So this is a problem. It's a problem for some labs and some people in particular. It's the problem we're working on, but we are continuing to drive down those cases. And again, as a public health physician, I want people to know that we feel testing is important, but we can't test our way out of this problem. We need to lean on prevention, and that's making sure everyone's wearing a mask, washing their hands, and watching their distance from others.
Well, and Dr. Fauci said recently that when compared to other countries, we, quote, aren't doing great. And the numbers do bear that out when you talk about 160,000 deaths across the United States. Why aren't we doing great, and what do we need to be doing differently still?
Well, I think that 2 things can be true at once. It can be true that there are a lot of people out there doing the right thing, and also true that we need to do better. And so when you look at Finland, Norway, Sweden, Taiwan, Canada, we actually have a higher mask compliance rate here in the U.S. than they have in those other countries. And 160,000 deaths is tragic by any metric. I want to remind people that back in March and April, there were public health experts, many of them predicting that we would have well over 1 million deaths at this point. And so thanks to people doing the right thing to flatten the curve, we've successfully dropped those death rates to a percentage of what people previously predicted. But that doesn't mean we can't and shouldn't do more. We must stay vigilant And I think honestly, it's because that it's summertime. In summertime, we know that people want to go out to family gatherings, to picnics. They want to hang out. And what I would say to folks is we can get through this, and we can get through this and get to a place where we can safely reopen. But if people just ignore those basic public health measures, we're going to continue to see spread increase, and we're actually going to lose choices and lose freedom because we're going to be forced to shut down schools, worship. I'm a Colts season ticket holder still. I want to see the Colts play in the fall. That's not going to happen if people don't take on the minor inconveniences of wearing a face covering and watching their distance when they go out and being meticulous with hand washing.
Well, and speaking of football quickly, there's a lot of questions, a lot of confusion this week, some really different approaches out there. High school teams are about to take the field, but the Big Ten, the Pac-12 have decided based on health guidelines that it isn't safe. Other conferences still plan to play. The president himself was encouraging the season to move forward. Is that wise to do in your view? And does this speak to a lack of consistent messaging more broadly, not just on football, from the government on what is safe and what isn't safe right now?
Well, here's the challenge. The United States is a big country. We get compared to New Zealand. Indiana has a population larger than the entire country of New Zealand. We get compared to Germany. Germany is geographically the size of Montana. If you're in a place that has a low positivity rate and a low transmission rate, you can safely reopen knowing that there's a low chance of disease getting into your school or into your football team. If you're in a place with runaway transmission, and right now, I wouldn't call Indianapolis and Allen County runaway, but they're in our red zone, then you need to be more cautious. We want people to make informed decisions and recognize they have the power to lower transmission and to safely reopen.
All right, Dr. Adams, thank you so much. We appreciate it. Thanks for your time. Meantime, in Washington, the debate continues over another stimulus package. With the Senate now on recess, our Kayla Sullivan spoke this week with Indiana Senator Mike Braun about the stalled negotiations.
Each day I get updates, and apparently there's been no move on it. Sometimes this has got to get closer to a point where you either do it or there's a point of no return, and you're also looking at the election, which is now counting down under 90 days, that's going to come into play. So if they do get something done, it's between Mark Meadows, Steve Mnuchin, and Nancy Pelosi, and we'll get called back to vote on it.
What do you think about Joe Biden's pick for VP?
So I don't know Kamala well. She was out campaigning for a good stretch there when she and Amy Klobuchar, Bernie Sanders, and a few others. I think that she is going to be teamed up with Joe Biden, and I think it's going to be a more left agenda than what the Obama-Biden platform was. And all I can tell you as a Main Street business owner, we were not doing near as well with those policies as we did post-Trump. Regardless of what you think about his style, his presentation, the policies were there that reinvigorated Main Street. And first time, wages were rising for those that needed it the most. That didn't happen with Obama-Biden policies. It'll even be worse under a Biden-Harris platform. So that's going to be my job, is to convince why that would be a bad decision for voters to want to go back to that. We need to stick with what was working, and that won't.